Hello, everyone, and thank you for joining me today. My name is Kira Ingram, and today I will walk you through some key aspects of Maryland workers' compensation billing guidelines with a focus on the importance of pre authorization. Since our clinic recently started seeing workers' compensation patients, it's essential that we understand these guidelines to avoid claim denials and ensure smooth operations. Workers' compensation claims can be more complex than standard managed care claims, and today's goal is to help us get familiar with the process of obtaining pre authorization, why it is important, and how to apply these rules correctly. In Maryland, workers' compensation coverage is regulated by the Maryland Workers' Compensation Commission. Employers are legally required to provide coverage either through private insurers or by becoming self insured. When an employee sustains a work related injury or illness, this system ensures that they can access medical care, wage replacement, and rehabilitation services. Unlike managed care, which covers general health care, workers' compensation only applies to workplace injuries or illnesses that occur as a direct result of employment. Why pre-authorization is critical in Maryland workers' health compensation. One of the most critical parts of handling workers' compensation claims is obtaining pre-authorization. For certain procedures and treatments, pre-authorization helps ensure that the services are medically necessary and aligned with a patient's recovery plan. In Maryland, failing to obtain pre-authorization can result in denied claims, causing delays in reimbursement, and potentially leaving the clinic or the patient responsible for unpaid services. This is especially true for procedures like diagnostic imaging, surgeries, and extended therapy sessions. Common procedures requiring pre-authorization. Let's take a look at some of the most common procedures that require pre-authorization. Imaging tests such as MRIs and CT scans often require pre-approval. Surgeries, including minor outpatient procedures, need pre-authorization to ensure they are related to workplace injuries. Specialist referrals and physical therapy beyond the initial approved number of visits also require prior approval. For example, imagine we have a patient with a work-related shoulder injury and we need to refer them to an orthopedic surgeon. Before scheduling that appointment, we must submit a pre-authorization request to the workers' compensation third-party administrator, or other word, TPA. Without prior approval, the referral could be denied, leading to an unpaid claim. Steps for this process would be step 1, verifying the patient's workers' compensation coverage. This includes contacting the employer or the insurance carrier to confirm eligibility and obtain necessary claim information. Step 2 would be submit the pre-authorization request using the appropriate CPT codes and medical documentation. For Maryland workers' compensation, it is important to use correct coding to avoid delays. Step 3 would be coordinate with the case manager or TPA assigned to the case. They will review the request to confirm that the procedure aligns with the patient's treatment plan. Step 4 would be follow up regularly to ensure approval is granted before proceeding with the service. Step 5 would be document all communications with the TPA or case manager for future reference. This documentation will be useful in case there is a dispute or appeal. Handling claims that are denied due to lack of pre-authorization. We've had some recent cases where claims were denied because providers were unaware of the pre-authorization requirements for specific services. If this happens, the best way to resolve it is to appeal the denial promptly and provide the necessary documentation to demonstrate the medical necessity of the service. However, the goal is to prevent these situations by ensuring that everyone in the clinic understands pre-authorization process. Before we move on, let's highlight a few important differences between workers' compensation and managed care plans. In managed care, billing is more straightforward and pre-authorization requirements vary between plans. Workers' compensation, on the other hand, involves strict documentation, coordination with TPAs, and specific coding. Additionally, workers' compensation requires progressive notes to ensure the patient's treatment aligns with the recovery goals, something we don't encounter in managed care. An example of pre-authorization would be we have a patient who sustained a back injury while on the job. The provider orders an MRI to determine the extent of the injury. To avoid claim denial, we must submit a pre-authorization request to the insurance carrier, including CPT codes, documentation from the patient's initial evaluation, and a treatment plan. If the TPA grants approval, we can schedule the MRI. If we skip the pre-authorization step, the insurer will likely deny the claim and the clinic will not receive payment. To prevent future claim denials, we can take the following steps. Step 1, develop a pre-authorization checklist specifically for Maryland workers' compensation patients. Step 2 would be train staff to identify when pre-authorization is required. Step 3 would be communicate with patients about any delays that could occur due to the need for pre-authorization. And step 4 would be assign a designated staff member to coordinate with TPAs and manage the pre-authorization process. In conclusion, understanding the following pre-authorization processes is critical for smooth operations when dealing with workers' compensation patients in Maryland. By ensuring the procedures are pre-approved, we can reduce claim denials, minimize disruptions in patient care, and secure reimbursement for the services we provide. Thank you all for your attention today. If you have any further questions or you need any clarification on any parts of this process, please feel free to reach out. Thank you so much.